We will get started in just a few seconds as people keep signing in.
So nice to see all these fun attendee names popping up.
Okay. Hi, everyone. Thank you all so much for joining and welcome to this week's Entwine exclusive. My name is Ariel Sokoloff and I'm the Senior Engagement Manager at JDC Entwine. For those of you who don't know us yet, Entwine is the young adult platform of JDC, the Joint Distribution Committee, which is the world's leading Jewish humanitarian organization operating in over 70 countries worldwide. Entwine Exclusive is a weekly series that was created to give people a behind-the-scenes look at how JDC responds to global crises and help you feel connected to the global Jewish world. Just a few housekeeping tips. We're going to be monitoring the Q&A here on Zoom. We also have some people joining us on Facebook Live, and we have somebody there who will monitor the comments. And we're going to have some time to answer some questions at the end of the session. This week's featured speaker is going to be interviewed by Entwine's own Andrew Belenfant, who's our Director of Engagement. Andrew, thank you so much for being here, and I'll turn it over to you.
Thanks, Ariel. I'm excited to introduce Josh, who is really the featured speaker of today. I just get to sort of be the Anderson Cooper to his amazing content that he's going to be sharing with all of you in the world. Josh Yudkin is currently our Ralph Goldman Fellow. This fellowship is one of our favorite and most special fellowships, and it's awarded to one person annually. And it's pretty amazing that this year's Ralph Goldman Fellow, Josh, actually also happens to be an epidemiologist. So what an opportunity for Josh to be able to work on a lot of our responses to what's happening in the world right now, which we are going to get to do a deep dive into. So Josh is currently based in Israel, and while normally the Ralph Goldman Fellow travels to a few different countries abroad, he has stayed there to really work on the task force that's really responding to Corona and COVID-19. So Josh, thank you for being with us today. I thought we would start by you just telling us a little bit about yourself.
Yeah, thanks so much for organizing this and having it. I'm really excited to see so many familiar names and people and get to be sharing this experience with everyone. A little bit about me. I'm from Dallas, Texas originally. I went to Washington University in St. Louis for my undergraduate and master's degrees. And I'm currently pursuing a PhD in epidemiology, like Andrew said, at the University of Texas in Dallas. And I guess between going to WashU and Texas, I worked in various settings, private, public sectors and whatnot. But, I think kind of background on the health side, I had the opportunity, I've been connected to a clinic in Mexico for about 12 years that works in the rural part of northern Mexico, looking at chronic conditions and eye surgeries. I did some really interesting work in southern India, looking at Tamil Nadu at cardiovascular disease and how it disproportionately is affecting some of the rural communities there. And I recently just found out actually the work I've been doing in Colombia just got a Fulbright for next year. So we'll be doing some research looking with their Ministry of Health there.
That's amazing, congratulations.
Thank you, yeah. So I'm pretty excited about that. I learned actually about the Joint Distribution Committee, the JDC, when I was working at Hillel's International Office as a chief of staff. And I was really amazed to find this Jewish organization that was so aligned with so many of my own interests that I had actually never even heard of before. So, to find an organization that was really working on a global level with community development and building resilient communities, public health, education, Jewish identity, was really inspiring. And so when I found out about it, I learned a little more and I applied and was lucky enough to actually be selected to go on an Entwine experience to Sarajevo in Bosnia and Herzegovina. And since then I've stayed involved and I was able to chair trips to Cuba and Rwanda, and now I get to serve as the Ralph I. Goldman Fellow for the year.
Thanks for the intro and the background on who you are and what you're doing. Tell us, I know I sneak peeked this by saying that you are currently in Israel, but tell us what's happening on the ground and what's the reality there and what are you experiencing?
Yeah, Israel's always a dynamic and exciting place to be. So excited to share a little from my very limited sliver here. Like you said, I'm based in Tel Aviv right now. So I'd say it's a mix of realities. I think it's also a fairly dynamic reality that's changing from day to day. So I'd say on one hand, the streets are fairly empty. Generally, people are self-quarantining per the advice of the government and whatnot, to the point that even family members that are living in the same city, just a few blocks away from each other, are really not even visiting each other. I think a lot of people, especially in bigger cities like Tel Aviv, have actually gone back to family homes in other parts of the country, like, to the Ramat HaGolan in the north and whatnot, to really be able to be with family. But at the same time, per the guidelines, you can engage in sport as long as you're less than 5 in a group and more than 2 meters apart. So personally, at least for the past week or so, I've been finding my calm and my escape going for a nice run on the beach. And when it is sunny, that place is pretty packed. But as of exactly an hour ago, they changed the guidelines, and you're only allowed now within 100 meters of your home. So I'm not sure how feasible that's going to be for a run anymore.
You'll just run in circles around your apartment building.
Right, exactly. I think actually there was a clip about someone in Italy who ran a marathon in one place or something. So I think people are getting very innovative as to how they're getting their in-home workouts. But yeah, I mean, I think like most places, I think professionally, I was on a conference call earlier, and one of my colleagues in Modi'in, she's like, I apologize for joining, so out of breath and hyperventilating. But I was just doing Zumba with my kids to keep them entertained. So I think there's definitely a work-life balance challenge that we're seeing around the globe. And I think the funniest one or the most interesting one was somebody. Every video conference call we've had for the past 2 weeks, a colleague's been in her car because there's not a quiet space at home since so many people in the home are on conference calls. So she has designated her car as her conference call space. So I think people are pretty flexible, and I think they're in many ways, the Israeli mindset is lending itself to handling the unique situation. But besides, really that educating and engaging children at home, I think it's really, there was this interview I heard on the news a couple days ago, and it was someone who grew up in Tel Aviv and now is raising a family in Tel Aviv. And he said, I've lived through many operations and many wars, many terrorist bombings and whatnot in the city. And I've never been in the city before, no matter what the fear was, where they've literally shut the whole city down. And so I think in many ways, it's a familiar, but it's definitely a new reality.
Mm. Yeah, and I think testing people's ability to be resilient. I think one of the things we'll learn from this is how we actually unify in community amidst all of this sort of isolation and distancing.
For sure.
Yeah. So obviously, as Ariel introed so beautifully when we started the call, JDC is actually responding to crises all over the world, and this one is not exempt from that in any way. So wanted to hear from you about what are some of the challenges you're actually seeing in Jewish communities globally right now.
Yeah, great question. I think probably the most perhaps physical or obvious challenge that I think Jewish communities are facing, Jewish peoplehood, I think, is based around coming together to celebrate good times and bad times. So what happens when we physically can't actually gather together? So I think, there's been everything from, online minions that have been happening. But I think the biggest question that people are facing today is, what about Pesach? How do we have a Seder, when we can't all gather around the same table together and tell the story? So I think that's probably the most tangible question. I think another question kind of on an organizational level is, who do we as local and national, perhaps even international Jewish organizations prioritize? What do we as local, national, and international Jewish organizations prioritize? And how does this virus really change our priorities? And I think, kind of thinking about in light of this pandemic, where does that put us? And probably the last question that I think it's raising is, or the biggest challenge is, in many ways, I'd say the pandemic, it's a new experience for the organized Jewish community because, I think the Jewish community and Jewish communities have done an amazing job. We always come together and we rally, for the good, for the bad, for celebrations, but also, against anti-Semitic activity, terrorist attack, any challenges that have been affecting our community, but also even supporting other communities that have experienced, repression, xenophobia, and other situations. And so I think really, how does the Jewish communities or community come together to support such a universal issue? And I think that question's been the one that's resonated with me the most. And I've been thinking about it a lot. And I think kind of in the same way that the virus does not discriminate, I don't think really our response as a Jewish community should either. And there's this phrase, especially I know in Entwine we talk a lot about, that says Kol Yisrael Aravim Ze Bazeh, which means that all of Israel is responsible for one another. And I think if anything, it's in times like this where we really shouldn't be so myopic in our thinking, and we should be reminded of the global Jewish community and how we really need to be acting together and acting for all.
Yeah, I think you're actually highlighting something really powerful, which is that there are so many situations we encounter in the world which actually show our differences, and this one is one that is showing our similarities. And so your question around what does it mean to come together on something that really is affecting and impacting everyone is a really powerful one, and thinking about this as a universal issue is really important during this time. Tell us, let's just take a step out for 1 second. Tell us what are some of the bright spots in all of this?
Yeah, no, I think there's always beautiful things that happen, I think, in times of crisis, or in challenging times. And I think definitely here in Israel, but I've heard stories about this in other communities around the world as well. I think, youth are going around and they're volunteering and taking food to elderly or people that may not have families and supporting them. I can tell you here in Israel, I was just talking with a friend who lives with his grandmother in Tel Aviv. And he's been going couch surfing for the past couple of weeks because it's so important for him to not be at home and potentially infect his grandmother. So he's been really staying with friends because he's really trying to do everything he can to take care of, more vulnerable populations. And I think it's kind of those small actions, those things that on one level are fairly individualized, but on one level are so symbolic, and I think really representing the way people are going above and beyond to take care of the people they care about, and even complete strangers, I think speaks so loudly. I think on a more macroscopic level, I think it's watching people put their Jewish values into practice professionally as well. So, I think, one of the amazing opportunities I have as the Ralph I. Goldman Fellow for the year is to be able to work with different teams at the Joint, at the JDC. And, I think right now I'm working with the GRID team, and that's a team that works primarily with, non-sectarian communities around the world. And we've been doing a lot of work looking at about how to support, communities in Ethiopia. And I think just the rich discussion and the thoughtfulness and the intentionality that the team really employs when thinking about, what does it mean to really focus on vulnerable populations and the moral obligation, focus on the poor of the poor, how we can really be there and set an example. And it's not just a quick fix, but it's really setting the stage for a sustainable intervention that's going to help people. And I think, especially dear to my heart and my research that I've done previously is how are we doing it in a way that is, it's in line with the community needs and what the community is articulated. And so it's working with on the ground partners and asking them, what do you see? It's talking to the government and saying, what are your needs? And I think it's really doing it in a way that's not only culturally tailored for their needs, language and whatnot, but also in a way that's respectful and in accordance with how they prioritize their own community needs. Yeah, and I think lastly, also just, going to a totally different region of the world. This was 2 weeks ago, was, I think in terms of organizational planning, in the former Soviet Union, so this is a region where they're working all the way over from Belarus and Moldova to Tajikistan. There's a question of how do you support employees, how do you support clients, how do you support communities, and how do you do it in ways where you're not necessarily preventing communities from coming together, but you're supporting them doing it in a safe way, in a way that's healthy and respectful of everyone. And I just think that the thoughtfulness and the difficult decisions, and the way that it's being made in accordance with local partners, I think is just, it's really impressive.
Yeah, and in line with a lot of the way that JDC does its work anyway. So I think one of the things that's become really important is ensuring that the values and commitments we make organizationally are consistent regardless of whatever we're responding to. And I think some of the locations that you highlighted are really important. Are there any specific examples of things happening in each of those places you could share, a sentence or two about quickly before we move to our next question?
Yeah, I think for Ethiopia, I think there's this question of, where do you intervene? And so I guess when I put my kind of epidemiology hat on for a second, we always say there's kind of 3 levels of prevention. There's primary prevention, there's secondary prevention, and there's tertiary prevention. So primary prevention in my brain is kind of your classic prevention. That's your, like, we should wash our hands, we should create social distancing. Your secondary prevention is your testing. And the tertiary prevention is how are you treating and providing the care for people that have already been infected with the disease. I think that's like a really difficult question in terms of, with limited resources and limited access, you know, where do you prioritize that? And I think, you know, at least for where we're sitting in terms of the work in Ethiopia, I think we, you know, made a decision that the two places where we could intervene most strategically was in that kind of primary prevention and that tertiary prevention. So I can tell you the hospital and Addis, you know, as of a few days ago, at least, they said that they had, I think out of the 500 possible beds that were possibly able to use to treat coronavirus positive patients, only 90 of them were ready to be used. And so there was a question of how do we make sure that the other 410 beds are available? I think in terms of prevention, you know, there were healthcare centers that said that they didn't have hand sanitizer to use between patients. And there are definitely areas that don't have running water with you know, for hand washing. And so I think we're really going in trying to figure out how do we provide, you know, the best way for people as lay individuals to engage in hand washing, for professionals to be able to keep, you know, use hand sanitizer and clean between patient visits, and really make sure the hospital's up and ready, because while there's only a few cases in Ethiopia, we can expect the number to grow pretty rapidly in the next little bit.
Yeah, as it has in so many places globally. And I think if we do some of this early prevention now, it'll help us to not get to the place where other countries have.
For sure.
Yeah, you spoke a lot about working in tandem with local communities as being a primary value that guides you, and certainly guides the work that we're doing organizationally. Wanted to hear from you a little bit about, like, what is a Jewish value that's actually guiding you right now?
Yeah, it's a good question. I think there's so many Jewish values at play right here. I think every discussion is like inherently embedded with Jewish values and really, like, you know, rich tradition.
Yeah, all of the Jewish values are guiding us.
Exactly. I would say, you know, if I were to take two of them and kind of put them together as, you know, opposite sides of the same coin, I would say it's probably pikuach nefesh and tikkun olam. So pikuach nefesh would be, you know, one's obligation to save a life. And tikkun olam would be, you know, repairing the world, is how we kind of traditionally translate it. In terms of the former, for pikuach nefesh, you know, there's this saying that we love to use, which is, he who saves just one life, it's as if he saved the world. And, you know, I think it's our job to protect each other. And in fact, like, you know, the responsibility falls not just on healthy people who are not immunocompromised, typically younger, to be able to follow the guidelines and really, you know, create the social distancing, but it's also on, you know, it's also for vulnerable populations to be able to take care of themselves and take that extreme precaution at home. And so I think it's really on the entire community to work together and make sure that we're doing what we can to help each other and creating a safe space. There's this quote, which is actually from Pirkei Avot, which I think we are about to post. Yeah, we just posted great into the group chat.
So for people who are on the call, Pirkei Avot translates to the ethics of our fathers.
Exactly, yeah. So it's a Jewish text, Ethics of Our Fathers. It's a lot of rabbinic teachings. And there's this one, if you want to find it, it's chapter 3, verse 22. And the text is right there, so I'll give everyone a chance to read through it. But basically, at its core, if you don't have a chance to read through it, it's this discussion that says, you know, it's a metaphor of a tree, and it says which one's more important, the branches or the roots. And the rabbis interpret it as the branches as knowledge and the roots are actions. And at the core of its teaching, it says, you know, at least I interpret it by saying that Judaism is about action. It inspires us to act, to act. And so for me, I think professionally, it's really inspiring to work to combat the spread of coronavirus through my work with the JDC. But I also think on a personal level, right, it inspires us to make sure that just because we can walk outside and we can go to places doesn't mean we should. And how do we really, you know, intentionally be inactive and take that step to make sure we're protecting everyone in our community as well. Just a quick note, I guess, on the flip side of the coin for Tikkun Olam, you know, I think on one hand, we're totally responding to this new concept, this new phenomenon that's happening today. But I guess I just want to pose the question and think about, you know, where is this going to put us in the future? And so I was reading a paper, a big leading paper from the US today, and the journalist referred to the corona pandemic as a test of national character. But I find that really ironic because there's really nothing national about this experience. In fact, I think it's a completely international experience, and I think it transcends all national and international and supranational bodies that exist out there. And this is really about us coming together globally to be able to combat what's affecting everyone. And so I guess I hope that as we curb the pandemic and we kind of move post-pandemic, I'd love for us to kind of come together as we have so many times before after other pandemics and other global challenges, and really think about how we're working to make the world a better place and in a better place than where we started.
There are like 500 threads to follow with all of the brilliant wisdom you just shared with us. One thing that I'll just reflect on really quickly is when you spoke about saving one life, meaning that we have the opportunity to save the whole world. I've seen that text many times in my life, and right now that actually, as you spoke it out loud, it really struck me in such a powerful way to really think about what it actually means for us to take personal responsibility for the world. There's something incredible about this being an opportunity for that. And so I wanted to just thank you for that wisdom and for giving us new meaning to an ancient Jewish text, given the circumstances we're living in. The tail end of what you spoke about was really about what does it actually mean to be responsible for global communities. You made a really clear point of saying this isn't just about our national crisis, but it's also an international crisis, and that we all are responsible for people all over the world, not just the people in our local communities. So I wanted to pose to you, at a time when we're all forced physically to stay very local to the communities that we live in and the communities that we're a part of, how can we care for the global Jewish world? What does it actually mean to take on that responsibility? And what can we be doing to support global Jewish community right now?
Yeah, I think it can mean a lot of things. I think that's a big question in of itself.
Yeah, I'm only going to give you tough questions today, so.
Well, I appreciate that. I think it's a super. I think it's a super individualized question. I think for me, and I hope maybe this will resonate with some people. We live in kind of, there's this great term, and at least they use a lot of times in healthcare research, glocal, where it's like global but also local. So we'll talk about like obesity as a global issue. So I think we live in this kind of localized world where through just day-to-day interactions, business, culture, trade, etc. We're all interconnected. I think I said this before, but the coronavirus doesn't discriminate against one nation versus the other. I think both in terms of its like biophysiological impact on the body, but also in terms of its like societal impact, like what it's doing to people. So, I guess I would ask us, or I wonder, if we could employ empathy for each other and kind of think about how we're all having a very similar experience simultaneously.
Mm-hmm.
And I'd want us to ask questions, because as much as it's a similar experience, it's unique. It's unique for everybody around the world. And so I think being able to have that empathy that says we're all going through a similar experience, but having the interest and bandwidth to be there to support people as their experience might be slightly different than you. This is an Entwine Zoom, Facebook Live session. So I think it would be remiss not to take the opportunity. I'm sitting here and, I'm thinking there's like this amazing network of Entwine people out there. I think for me, like, I'm just thinking of people from previous trips I've been with that have been everywhere from, New York to right here in Israel to Lithuania, Hungary, other locations as well. And I think it's taking out your phone and sending them a WhatsApp and being like, hey, how are you? It's a Facebook message saying, thinking of you, and just checking in and seeing how people are doing and asking that question. I think for many people that have had the opportunity to visit some of the amazing communities in which the JDC works, whether it's the former Soviet Union or other parts of the world, think about the home care worker who's spends their day traveling 4 hours by car to visit a person who can't get out of bed and make sure they're okay, to make sure they have their needs met, and send them a text message and say thank you. I know this is a really difficult time, and I wanted to say I was thinking of you. Ask if there's anything you can do. I think it's that opportunity to reach out to people, make them feel heard, make us feel connected, and know that despite the physical challenges, we're all here together in one community.
Should we pause for 30 seconds for everybody to pull out their phones and just text someone they're thinking about?
Love it.
All right, I'm counting down the clock, 30 seconds. Everybody pull out your phones right now, and you're gonna text someone that you are thinking about or that you care about or that you wanna send some love or empathy to. And Josh and I are also gonna pull out our phones.
I have my phone right here.
Nice. Nice. So I'm going to bring us back together. Thank you all for indulging in that, and thank you, Josh, for the call to really be thinking about people. I think there's something really powerful about the global and local interchange that's happening, where we can be thinking about the people globally, but actually treating them as if they're right there with us. And so thank you for that charge. Was wondering if you could talk a little bit about, I mean, you started to share some things about the former Soviet Union. If you could talk a little bit about some of the work that you are thinking about with the larger JDC task force in terms of responding in the former Soviet Union?
Yeah, I mean, I think, so if I can just take a second to give some background for people that may not be as familiar. The work of the JDC in the former Soviet Union is expansive. I mean, I think that it arguably it might be one of the areas in the world in which we have the most complex and robust operation. You know, I'd say everything from cheseds to the JCCs. So I mean, there's things where there are community centers where Jewish life is happening. There's co-curricular programming. There's Torah study, young adult engagement that's happening. But there's also, I think, one of the few places in the world where JDC is actually involved in direct service, which means that there are social workers going out to visit people. There are food that's being delivered, and it's a very comprehensive operation. And so, you know, I can tell you that there was a team sitting there that was really looking at kind of both the scope of operation and the depth of operation, and thinking through what needs to happen in order to keep operations happening in these regions, given the fact the coronavirus is spreading. And this started before there were actually cases reported in most of these countries. And so, you know, I can tell you strategically, there was a matrix that was built and kind of created a triage level of, if this level, this level, this level, how are operations going to be affected? And I can tell you there was a lot of effort that was put in. And unfortunately, we jumped from about level 1 to level 3 or 4 very quickly. And so I think, you know, what we're seeing is that, like, you know, the virus spreads very quickly, and it impacts programming. I think in the same way questions about how do we have a Pesach Seder happen when people can't gather, I think that's a real question in a region like that. I can tell you personally, you know, I was potentially going to be going to Kharkov and maybe helping a partnership they have with, that JDC has with the HUC in facilitating a Pesach Seder. And I think at this point it got canceled just because of the coronavirus. Wow. And so I think when you know, partners and agents on the ground are unable to actually be there, there's a question of what services can be provided. I think on the flip side, right, there's a question of we want to make sure we're doing good and not harm. And so while, you know, there was extreme energy and eagerness by, you know, home care workers to make visits, there was a real question that says, we're not so worried about the employee getting coronavirus from a bedridden individual, but how do we make sure that the employee who's taking all the precautions available doesn't inadvertently bring coronavirus to the clients in the area? So I think, you know, I think it's a level of scope, it's a level of scale, but I think the same questions that are being, you know, wrestled with there are happening in other areas of the world as well, just in a different manner.
Yeah, and as you're speaking, I'm even just thinking about how grateful or lucky I feel that we get to even do this work, and so, or that we even get to have these conversations. So thank you for that. So we are living in an age, for a lot of different reasons, where people are spending a lot of time on their phones now because they're stuck at home. You see various things online and text message groups and memes that are popping up all over the place. Sort of wanted to throw it to you, like, what are the things you actually, given everything you shared with us, what are the things you wish people were talking about right now? What conversations should people be having given the mediums that we're being, you know, forced to use at the current moment in time?
Yeah. I think there's two ways maybe I'd answer your question. One's directly about the technology. I think one's just in general. In response to the technology, right, I think you hit it spot on. We're living in this, like, digital age of, like, every interpersonal relationship, for the most part, except for the people under the same roof of you, is through digital mediums. And so, you know, I think on one hand, it's amazing and it's really fun to have these Zoom happy hours that we're doing, you know, potentially with work colleagues or, you know, friends or whatnot. But and they're definitely Insta-worthy posts. Let's not forget that. But is that? I
went to 3 Zoom birthday parties this weekend. I'll just say that out loud. And it was actually great because I got to go to all 3, which I normally wouldn't have been able to do.
Your social calendar is much busier than mine, Andrew. So that's
I'll invite you next time, Josh.
Thanks. No, but I think there's a question, right, of, like, is that meeting our need as individuals to have that connection? And so on one hand, I think it's amazing the platforms we have and the breadth of connections we can have. But I would question like, what's the depth of that relationship we're looking for as well? And so I guess I just would like kind of, want to take a moment so that we can all make sure that we're taking the time to reflect and and personally reflect and say like, what are our needs, and articulate them to those that are close to us to make sure that we're making sure that our mental health is in a place where we're doing okay, and that we're in a place where we can be able to give to others as well. I think a piece in terms of like all the digital kind of news and things that are going around, something that I don't think has been talked about, that I think is a really neat story that I hope people might consider thinking about, at least sharing, is, so we were talking about the prevention before, that kind of primary prevention, hand washing, hygiene, I think is one of those, is kind of a key piece of that strategy. I think that's kind of what I was sharing, JDC is leading in Ethiopia right now with some of our partners. But I think we forget sometimes that one risk factor or one activity actually has impacts on so many other things as well. And it can improve really the quality of life and life expectancy for people across the globe. So, whether it's UNICEF or the World Health Organization, there's a lot of reports that have talked about how anywhere between hundreds of thousands to millions of children die per year in diarrheal diseases. And, many of those can be prevented simply by engaging in healthy hand washing practices. And so I think, on one hand, coronavirus is definitely this like threat. It's like an imminent threat today, and it's something that we're all dealing with today. And it's definitely what's precluding us from returning to normalcy today. But I also think it's important to think about how us addressing these risk factors today is going to have such long-term effects in improving both not only the quality of life, but the life expectancy for so many, hundreds of thousands, if not millions of children and adults around the world.
Thanks. So we have been taking some questions from the audience and our team on the back end here, which I want to express eternal gratitude for, is pulling some of the questions. We're going to try and answer as many as possible, and they are coming up on my screen as we're speaking. So wanted to throw it out to you from the audience. In terms of JDC's work right now and current response to coronavirus, what are we all most proud of? What are you feeling most proud of?
Wow, I think it's so easy to get stuck in our own bubbles, and it's so easy to be sitting here and thinking about how, my life has been impacted, and how, you're in this uncomfortable, perhaps situation of discomfort. But I think the more people I've interacted with, the more gratitude I've been hearing. And I think people being grateful for the friends and the families that are checking in on them, whether it's like the number of FaceTime or Zoom dates they have set up just to, people that care about them. Or it's like appreciation of the fact that like, I can walk to the grocery store and I don't have to worry about food. I can make sure that I can have, a meal, on the table for my kids. I think there's so many people that have really kind of spun this experience and said, you know what, it sucks. And in many ways it does. But I think there are so many people out there that are really just, propagating and emphasizing their gratefulness. And I think for me, that's like such an encouragement and such a great feeling to hold on to, because I think it's so easy to get down. And I think it's really just powerful to hold on to those small moments of gratitude.
Yes, we should all hold on to that gratitude and take moments to reflect on that throughout the day. This one came up and it was sort of already answered, but if you want to add anything to it, I'm gonna let you answer it. The question is how you think JDC has been proactive rather than reactive in responding to the circumstances.
Yeah, I think JDC has a really dynamic role depending on the region of the world. And so in some parts of the world, so like for example, in Israel, JDC is a convener of organizations that are really working on social and welfare programs. I think, like I said, in the FSU, JDC takes more of a direct service role. I think in Africa and other areas where the grid team works, they really kind of work on like the disaster relief and kind of looking at it from afar and empowering local organizations to do it. So on one hand, I'll say the response has been entirely contingent upon the role JDC plays in that region. So I'm not sure that there's like a specific answer, but I will say some general trends that I've seen from my limited vantage point, is I think everybody from the second it broke out in China was like, we need to start thinking about this, and we need to start thinking about what we need to do. I think everyone's kind of been trying to create emergency plans, and they've been doing it in tandem with people on the ground in their regions. And I think everyone's trying to do it in a way that both follows international guidelines and recommendations, but also in terms of what the community has articulated as their needs. And so I think for me, I don't think there's a singular response, but I think those are kind of some general theories or guiding principles JDC has employed in terms of their response across the globe.
Got it. Thank you. So we have a question here that I think is really reminiscent of things that you said earlier in the call about what does it actually mean to care for people. And someone is really concerned about the babushkas in the former Soviet Union. And so there's a question here in response to the work that you spoke about in the FSU. Someone who really wants to know, how are the babushkas in the FSU doing? How are they feeling? They depend on our help. What is it like for them right now?
It's a good question. I could give a brief answer, but I feel like maybe the better answer, Andrew, would be for us to go back to the field and actually see if we could get some testimonies and share that with people, so that we're not just kind of giving the 1,000-foot view, but we can let people hear directly from what people there are experiencing.
I love that. You responded with your own call to action for caring for people individually and giving people real answers. So I am making a commitment, and Josh is making a commitment, and Ariel's making a commitment right now on the call to do some follow-up with everybody who's joined us today on how the babushkas are doing.
For sure.
Cool. So a question here about Israel. In the US, we're seeing a large rate of infections amongst Orthodox communities, and so wanted to hear if you know anything about how the Orthodox community in Israel is doing. I don't know if you know so much about that, but wanted to bring that question up since someone asked it in the Q&A.
Yeah, I haven't had so much firsthand exposure in Tel Aviv to the Orthodox community, but I can say there was an article I read this morning actually, and they were kind of breaking down where the point of infection was in the cases within Israel. And I don't know who asked the question, but it's weird that I have these numbers in my head, but at least according to this article, and this morning they said that I believe it was 29% of cases in Israel had a point of infection in a shul, and 5% were in a yeshiva. So I'm not, of course the number when we say 29% in a shul, that doesn't inherently mean it was an Orthodox shul. So I don't know how many of them specifically took place, within the Orthodox community. So there's a little bit of, ambiguity in that statistic, but I can say, I think there's, again, there's how do I want to say this? I guess on one side, you have leaders across the, Orthodox world that have come out and said, please don't kiss mezuzahs, about minions, kind of really taking these proactive steps that says let's take care of our community. But I think, I guess in a very different example, there was someone on the beach yesterday who was getting yelled at by the police for going swimming after they said no swimming. It was an older gentleman. The police officer goes, "You're not allowed to swim." And he goes, "Oh." He goes, "But you knew that." He goes, "Yeah." He goes, "Why did you swim?" He goes, "Because I swim here for the past 64 years of my life. Why would I stop today?" Right? And it was a really heartfelt answer. He's like, "I've literally woken up every morning of my life for 64 years and gone swimming. Why would I not?" And I think in the same way, for people that engage in a certain lifestyle and they're used to going to the yeshiva and they're studying in chavruta day in and day out, I think it's also hard sometimes to break those routines. And so that's a complete me interpreting the situation, but I think there's been great steps taken to protect the community, but I also think that when you look statistically, again, it was 29% in a shul and 4% were a yeshiva. So it's a pretty that's over a third of the population that were infected in Israel by some Jewish institution of some sort.
Talk about having empathy for someone's life circumstances that they're going through and the ways that they deal with their routine. I think we all know what it's like to experience being pushed outside of the norm of our routines and our typical comfort zones that we're all being challenged by right now. Yeah, I feel for that guy who just wants to go swimming.
For sure.
So I think I'm watching the time, and I want to be conscious of everyone's day, and feeling grateful that people joined us today. We have a lot of people logged on. This will be our last question, so you have an opportunity here. The question here is, there's a lot of sensationalist media out there, and so in your opinion as an epidemiologist, what is some info that we might be missing from a lot of the media that we're consuming on a regular basis? Is there anything that you could tell us that we're not seeing on the typical news channels?
Yeah, I mean, I guess, so to me, if I go back to where epidemiology came from, right? Epidemiology, a field, was about how do we translate what's happening in bench science and make sure the data is good, and then imply that, or employ that for policy recommendations. And so I think there's kind of this disconnect between what's happening sometimes on the ground and policies, and really how do we create that connection? So, I'll I'll pick a local example here in Tel Aviv. It's awesome that the government's taken such a proactive step, and I think pretty much most people around the world would agree that Israel definitely was one of the most proactive countries on the onset. But what happens when citizens don't follow those recommendations and they bring their iPod, their iPhone and speakers, and they're having like a picnic on the beach with like 6 of their friends? So
Right.
you can have the best policies, but if people aren't following them, it changes the equation. And so I think I think the sensationalized news is a result of, we know the best practices, but we have a challenge collectively, globally, not any country, not any city, but how do you actually implement and employ those recommendations in a way that's best for the people, where we're respecting people's civil liberties and respecting people's rights, but we're also doing it in a way that's best for the common, the common good there. And so I think it's really this clash of almost this like utilitarianism of the greatest good and like kind of that deontological approach of like what's best for the individual in that situation, and kind of thinking through how we put that together. So I think sensationalized news, it's based in a potential reality, but I don't think it's the most probable or likely reality. I think it's really about us coming together, supporting each other, following what we should do, and I think we'll get through this together.
Yeah, I'm struck by your ability to actually connect everything you just said to the 2 values that you shared earlier about the branches in the tree and then saving one life as if you're saving the whole world. There's something really powerful in the statement you just made that fully embodies those 2 things coming to life. What does it actually mean to care for every single person individually so that the greater good is actually taken care of? There's brilliance in your wisdom, Josh. I am incredibly grateful to be able to have this conversation with you, and for the work that you're doing on the ground with JDC globally right now, and for the fact that we have an epidemiologist who is our RIG fellow this year, and for all of the wisdom that you brought to us. Just wanted to say thank you before Ariel closes us out, to you for taking the time and for all of the work that you're doing, and for giving me the opportunity to actually have this conversation, and for giving our participants who joined us today the opportunity to hear from you. Thank you.
Yeah, and thank you and the entire Entwine team for building this intentional community, because I think it's really great that we all were able to take the time and invest in it together. So thank you.
Awesome. Thank you both again. My phone is currently blowing up from my friends in Rwanda that I messaged before. So making me feel really good to feel connected to the global world. I want to thank the audience and everybody who joined us. We hope that you will join us next Wednesday for our next Entwine exclusive. We'll be sitting down with Asher Ostrin, who's JDC's interim CEO, and Kate Belza, who's an alumna of our programs, and she's also a JDC board member. On March 30th, we're also going to be doing an Entwine Young Professional Spotlight with Joey Luskin, who's an alum of ours, who's going to be talking about his year-long service in Turkey. You can see all of these details, more upcoming events and programs that Entwine is running at the thread at jdcentwine.org. I'll post it in the chat in a second. And lastly, we are creating these virtual programs to help our communities stay connected globally. And we would love to hear what you've learned and what you're looking for through this, and just how we did on this session. So for you, those of you on Zoom, as soon as I close out, a SurveyMonkey link is going to pop up, just asking you a couple of questions, and we'll post it in the comments on Facebook. Yeah, thank you again, everyone, for joining us. Stay healthy, and we hope to see you on our next program. Bye, Josh and Andrew. Thank you.